I'm Jim Cates. I'm a psychologist in private practice in Northeast Indiana. I've worked in the mental health field since 1977, when I started as a house parent in a residential treatment center, and I have worked as a counselor since 1982. My counseling experience includes individual, family, and group, and I've worked in residential treatment centers, detention facilities, psychiatric hospitals, outpatient facilities, and I've done home-based services as well as doing substance abuse treatment. In recent years, I've also served as a supervising consultant for other practices. The purpose of this video is to talk about finding a counselor. And I want to say up front that there are excellent resources online to help you do that. And I would encourage you to Google those resources. This video fleshes out some of the areas that many other resources either don't discuss in as much detail or gloss over in their discussions. So use this as either a jumping off point or use it as a supplement to the other resources you find. But please do not use this as the only place you go to look at finding a counselor. I would really encourage you to go other places as well. Depending on what you need, remember, not all counselors use the same approach. And I'm not just talking about theory here. You'll hear counselors say, I'm cognitive behavioral, or I'm Adlerian, or I'm eclectic, which is a way of saying that they used several different theories to practice counseling. I'm talking about the model of interacting with clients, how they establish rapport, and how they keep the relationship with the client going. For example, one of the more gifted counselors that I've had the opportunity to work with was a woman who was very cognitive behavioral in what she did. She was very strict about using a cognitive behavioral approach. So everything in her work was about modifying thoughts and behavior. And that's what she did. She had exercises and she had worksheets that she used during sessions. And she worked primarily with children. But she would involve parents in this as well. And she would have them sit down in the sessions and do the work too, so that they could apply it at home, so that there would be carryover. For me, as a counselor, that type of approach would have been a disaster. I don't work that way, I can't work that way, it's not consistent with my personality. For her, lots of kids loved her. She had a full caseload for most of the time that I knew her. And she did a fantastic job of maintaining rapport and working with both children and parents. So she was able to match her therapy skills, her counseling skills, with clients who needed her. It worked, and it worked well. But that also shows the flip side of the coin, that not all clients have the same needs. Some are looking for a change in behavior, and for them, cognitive behavioral is an excellent choice. For the kids that came to her, lots of them were acting out in school or at home, and that acting out behavior responded extremely well to this approach. Maybe someone is looking at modifying an eating problem. Maybe they're looking at stopping smoking. Maybe they're looking at greater self-discipline. Again, cognitive behavioral techniques, wonderful choice. For other people, they may be looking for a better understanding of themselves. They may be looking at overcoming chronic anxiety or overcoming a chronic depression. And for them, there may be another choice than cognitive behavioral techniques, or a combination of choices that includes cognitive behavioral techniques that will be more effective. So depending on the needs the client brings, differing counselors will be more or less effective. And by the way, research shows that our training makes very little difference after a few years in how effective we are. Whether we're trained as psychologists, mental health counselors, marriage and family therapists, social workers, it doesn't really make a difference within a few years. It's the experience in the field, it's the experience treating clients that will make the difference in how well we do. And that said, not all clients have the luxury of choosing a seasoned therapist, a seasoned counselor. And counselors have to gain experience somewhere. So if you're in a position where you are not able to obtain an experienced counselor, I think the next best thing, and almost as good, is to find a counselor who has a seasoned or experienced supervisor, and they are receiving supervision on a regular basis. And by supervision, I mean they're meeting once a week, at most once every other week, with that supervisor to discuss cases, to go over their caseload, to talk about what they're doing. So if they have someone who has their back and is doing supervision with them, then you have the advantage of a skilled counselor working with you just from a distance. Remember too, counselors are human. We work hard not to bring our problems into the session. The hour is your time, and we're there to focus on you, and our emotional energy and our thoughts are invested in you, and that's what we're there for. That said, our lives do impact our work. As much as we don't want them to, as much as we try to keep that out of the session, sometimes it can't be helped. We have children, just like you do, and sometimes our children get in trouble. We have relationships that fall apart, so we end up separating, we end up divorcing from someone we care about very much. We have deaths in the family. We have money problems. Anything that happens to people happens to us. And as a result, there are days when we are just not as focused, just not as present as we would like to be. We have off days. My suggestion with that is don't judge a counselor based on one session that's off. Now, if 2 or 3 sessions go by and the counselor just doesn't seem to be with you, just doesn't seem to be tracking or as present as you would like the counselor to be, then maybe it's time to think, we need to move on. The vibe isn't there, the vibe is not going to be there. But don't make a decision based on one session. Give it more than one, because we do have issues that arise. That happens. Also, I want to talk about, at a practical level, some of the problems that can arise. Be clear with a counselor before starting the actual counseling about issues of confidentiality. What is confidential and who has access to the records? All right. Not all counselors understand or appropriately follow the law. Doesn't mean that they're bad counselors. It does mean they are confused about what is often confusing and complex legal expectations. And that shouldn't necessarily be true in the age of HIPAA, the Health Insurance Portability and Accountability Act. You get the same rights for mental health records as you get for your medical records. That same long privacy notice that you turn down at the doctor's office, you should have the option to turn down when you are offered mental health services. It's a lot of information, it covers a lot of ground, but it doesn't cover everything. For example, in your state, what is the right of a non-custodial parent to have access to a child's mental health records? In Indiana, it varies based on how legal custody is assigned and awarded by the court. So very often I'll have a parent come in and bring a child to me and say, I don't want the child's other parent to have access to these mental health records. Well, depending on how custody was assigned, how legal custody was assigned, and what the court has ordered, I may or may not be able to honor that request. And I need to see the information up front or hear the information up front to be able to say, I can do that or I can't do that. So those kinds of things I like to make sure about when they come in. Not all counselors do, and there can be a mess down the line when the other parent calls in or walks in and requests information about the child, and a counselor is not sure whether they can release information or not. Right? Also, for some problems of confidentiality, the law is silent, and HIPAA is silent. An example in Indiana occurs for children who become adults. For example, if a child is under the age of 18, parents have access to their mental health records. Anyone over the age of 18 and emancipated, unless somehow they continue to have a legal guardian, has access to their own mental health records, parents do not. That is very clear under the law. But let's say I start seeing a child who is 17 and a half, and I see them for 10 months. Well, for the time that they're 18 or older, their records are obviously theirs. Their parents no longer have access to their mental health records. But from the time they're 17 and a half until their 18th birthday, their parents had access to their records. But now that they're 18, do they have access to their records? Do their parents have access to their records? Or do they both have access to their records for that time period? Indiana law doesn't say. Those are the kinds of things, if I know that's going to potentially be a problem, I like to get that settled before we ever start counseling. And that resolves issues down the line. Law makes no provision for it. I need to make provision for it up front. You can, as the client, ask to make provision for those kinds of things up front as well. Who has access to the records if it's marital therapy or couples therapy? Again, some states have laws, some states do not. But if you're going in for marital or couples therapy, and there is no one wants this to happen, but if there's a messy breakup somewhere down the line, how do those records get released? Who has access to those records? Both of you? Neither of you? Only if both consent? Making those kinds of decisions before you ever start counseling can make a big difference about what happens down the line. Right? Also, make sure you know what insurance will pay. Too many clients assume that insurance will pay for or cover services. If you do not have a booklet from your insurance carrier that states specifically what's covered under mental health, and particularly if your insurance carrier uses preferred providers of some type, in other words, has a list of providers that it does cover, then make sure that the agency you're seeing or the counselor you're seeing is a covered provider and has what's called in-network benefits, or the maximum benefits allowed. If you're not sure, call the insurance carrier and find out, because ultimately that fee will roll back to you if insurance doesn't pay, or if insurance pays less than the maximum benefit. If you have strong beliefs, political, religious, spiritual, or moral, you may want to check the counselor or organization's stance. Very few counselors will openly contradict your beliefs or challenge your beliefs, but their values may still clash with yours, and at some future point, that could be a problem. And you may be more comfortable with a counselor whose values and morals align with yours. It's worth the effort to find that if you can, if you think that's going to be a problem. I encourage you to keep an open mind, but it's okay to be assertive. You can ask about the purpose of treatment. You can ask about how treatment is helping, or what will this do for me in the long run? How is this going to improve my situation? You can ask that question in such a way that you're going to make the counselor defensive, but you can also ask in such a way that you're making it clear that you want to be part of the treatment. And in that regard, know that counseling is never a passive process. Counselors can help to motivate a client. We can provide avenues to create insight. We can encourage. We can light the path. But ultimately, the client is the person responsible for making change. So whatever you're facing, whoever you see, I genuinely wish you well in your journey, and I hope the best for you. Take care.